We are in a crisis. Not only are, 6 people dying a day in British Columbia, the mortality rate is through the roof.
Providence Healthcare has committed to make the journey for substance use treatment the same as those needing other life-saving interventions. The goal of Road to Recovery is to create a seamless system of substance use care for British Columbians like systems that already exist for other chronic health conditions. R2R is funded by the province of BC as well as private donors, the Ronald S. Roadberg Foundation, the Diamond Foundation, and Peter Bull.
We've had tons of amazing addiction services across Vancouver for many years, but many of them have always been functioning in these silos. There was multiple different wait lists. Patients would be handed a list of different services, be expected to access them on their own, plus adding being in the midst of, a pretty severe substance use disorder. People were always getting lost in the cracks.
We're transforming how patients access substance use care by working with Vancouver Coastal Health colleagues to implement an integrated medical triage model via Access Central.
Road to Recovery offers a very unique and streamlined process for patients that are suffering from substance use and withdrawal management. And it's really meeting the patient where they're at when they're ready for detox and for treatment, and then moving them through the system so that we can actually support them.
We have 25 withdrawal management beds open, embedded within an acute care hospital, supporting the most acute clients.
We have, for instance, a Code Blue team. We have on-site relational security, critical care trained staff, or access to critical care trained staff. That means that people who may be more medically complex or behaviorally complex can be admitted for their withdrawal management. And so that contributes to health equity.
Especially when you think of folks who are unhoused, those who are structurally vulnerable. These types of patients who come to detox often have to wait 1 month, 2 months, sometimes 3 months before they can get into treatment.
We've gone from clients waiting up to 30 days for a detox bed down to just 1 day for those triaged as most urgent.
It's really supporting their functioning, either their day-to-day functioning or even having them become more integrated within the community when they leave hospital, or supporting them going to treatment or second stage or recovery housing.
We have a 20-bed transitional care unit open, and we've launched an aftercare team in community.
One of the gaps that we really recognized was the role for peers. And then I think the other thing that's very unique to Road to Recovery is our incredible collaboration with the Indigenous Wellness and Reconciliation team here at St. Paul's.
Once they make the decision, everything falls into place, and I'll do my best to support them.
I would say that cultural safety is a huge aspect of it, as well as harm reduction. Definitely approaching them from a non-judgmental place. And some of them, do come back, and it takes them 3 times, 4 times, as many times as it takes. And we never shame them or anything for coming back to Road to Recovery.
We have up to 22 treatment beds contracted in community, and will be opening 26 supportive housing units and 50 treatment beds in the coming year.
We've come up with a pretty large and expansive evaluation that includes a health services evaluation. We've been able to also pair that with a research evaluation of an ongoing prospective cohort study where we recruit patients and really get more granular details about their substance use patterns and about their treatment outcomes.
People have reported overwhelmingly positive experiences with care. Retention on medications for opioid use disorder has been strong, and the model is now being replicated province-wide with tailored solutions specific to each region. The Road to Recovery is a journey, and we're proud to walk alongside people on it.